Top 25 Care Coordinator Interview Questions and Answers. If you're preparing for a care coordinator interview, today's video will give you everything you need to stand out with confidence. Care coordinators play a vital role in patient support, healthcare communication, and organizational efficiency, and employers look for strong communication, empathy, and problem-solving skills. In this video, we'll go through the top 25 care coordinator interview questions along with professional, impressive answers. So grab a notebook, stay tuned till the end, and let's help you ace your next interview. 1. Tell me about yourself. A strong answer emphasizes your background in healthcare support, communication, and organization. Talk briefly about your relevant experience, skills, and passion for patient care. For example, I have worked in healthcare settings for several years, supporting both patients and clinical teams. I'm skilled in coordination, documentation, and building trusting relationships with patients. I enjoy helping people navigate the healthcare system and making sure they feel supported. Over time, I've developed strong scheduling, communication, and problem-solving abilities that help me manage multiple cases efficiently. I'm excited to bring those strengths to this role. 2. Why do you want to work as a care coordinator? Focus on your passion for patient care, communication, and improving healthcare experiences. You might say, care coordination allows me to directly support patients and ensure they receive consistent, high-quality care. I enjoy building relationships, solving problems, and helping people understand their treatment plans. I'm motivated by roles where I can make a real difference in someone's health journey. Being a care coordinator aligns perfectly with my strengths in communication, empathy, and organization. I find it rewarding to help patients feel heard, supported, and confident throughout their care process. 3. What skills make you a strong care coordinator? Highlight communication, organization, problem-solving, and empathy. For example, I bring strong communication skills that help me build trust with patients and collaborate effectively with medical staff. I'm highly organized, allowing me to manage multiple cases, schedules, and documentation efficiently. I'm also detail-oriented, ensuring accuracy in records and follow-up care. My ability to stay calm under pressure helps me support patients facing stressful health situations. Additionally, my knowledge of care plans, insurance processes, and patient education helps me guide individuals through their healthcare journey with clarity and compassion. 4. How do you handle difficult or emotional patients? Your answer should show empathy, patience, and professionalism. You can say, I approach emotional patients with compassion and calm communication. I listen carefully, validate their feelings, and provide reassurance. Rather than reacting to frustration, I focus on understanding the root of their concern. I give clear explanations and help them feel supported, not rushed. If the situation escalates, I maintain professionalism and involve appropriate medical staff. My goal is always to create a safe, respectful environment where patients feel heard and understood. This approach helps build trust and reduce stress for everyone involved. 5. How do you prioritize tasks when you're managing multiple patients? Show that you understand time management and care urgency. For example, I start by reviewing my caseload and identifying tasks based on urgency, patient needs, and deadlines. I prioritize clinical issues first, such as medication coordination or urgent follow-ups. Then I schedule routine tasks like documentation and appointment confirmations. I use digital tools and checklists to stay organized and avoid missing important details. Communication is key, so I keep both patients and staff updated on timelines. By balancing urgency with efficiency, I'm able to manage multiple responsibilities while maintaining high-quality care. 6. Describe your experience working with electronic health records, EHR. Emphasize familiarity, accuracy, and confidentiality. Example: I have extensive experience using EHR systems to document patient information, schedule appointments, update care plans, and communicate with care teams. I'm comfortable learning new software quickly and always ensure accuracy when entering data. I'm also careful about patient privacy and HIPAA guidelines, making sure sensitive information is protected. Using EHR effectively helps me improve workflow, reduce errors, and provide seamless communication between providers and patients. I value how technology supports better care coordination and makes record-keeping more efficient. 7. How would you handle a situation where a patient is not following their care plan? Show patience, communication, and problem-solving. Example: I begin by asking open-ended questions to understand why they're not following the plan. Sometimes barriers include confusion, fear, financial limitations, or lack of support. I listen without judgment and work with them to modify the plan if needed. Then I offer education, encouragement, and practical resources that make adherence easier. If necessary, I involve the care team for additional support. My approach is to partner with the patient rather than blame them, so they feel motivated and empowered to improve their health. 8. How do you ensure accurate documentation? Discuss consistency, attention to detail, and time management. Example: accurate documentation is essential for quality care and communication between providers. I ensure accuracy by entering information immediately after patient interactions while details are fresh. I review my notes for clarity and completeness and follow organizational guidelines for record keeping. I double-check critical data like medication lists, diagnoses, and follow-up appointments. I also stay organized with digital tools to avoid missing updates. My goal is to create reliable records that support continuity of care and help the entire team work efficiently. 9. Tell me about a time you resolved a conflict in the workplace. Show communication and teamwork. Example: in my previous role, two team members disagreed about patient scheduling priorities. I stepped in to facilitate a calm discussion. I listened to each person's concerns, identified the root issue, and suggested a compromise that balanced patient needs with workflow demands. Once both sides felt heard, they agreed on a revised system that improved efficiency. This experience taught me the importance of clear communication, empathy, and collaboration. I believe conflict can be resolved productively when everyone focuses on solutions rather than emotions. 10. How do you maintain confidentiality in your work? Show awareness of HIPAA and patient trust. Example: confidentiality is essential in healthcare, and I take it very seriously. I follow all HIPAA guidelines and organizational policies when handling patient information. I only access records necessary for my role, avoid discussing patient details in public areas, and secure documents properly. In digital systems, I use strong passwords and log out when stepping away. I understand that patients trust us with their sensitive information, and I make sure my actions always protect their privacy and dignity. 11. How do you deal with a high-stress environment? Focus on calmness, organization, and resilience. Example: healthcare environments can be fast-paced, and I stay grounded by staying organized and focused. I prioritize tasks, use checklists, and manage my time effectively to keep workload under control. I take short mental resets when needed and communicate clearly with the care team to avoid misunderstandings. I try to approach stressful moments with a problem-solving mindset rather than reacting emotionally. Over time, I've learned to stay calm, adapt quickly, and maintain professionalism even during busy or unpredictable situations. 12. What do you know about care coordination? Demonstrate understanding of the field. Example: care coordination involves connecting patients with appropriate healthcare services, ensuring communication between providers, and helping patients understand their treatment plans. It includes scheduling, follow-ups, documentation, education, and addressing barriers like transportation or insurance issues. A care coordinator acts as a bridge between patients and the healthcare system, making sure care is consistent, organized, and patient-centered. The goal is to improve outcomes, reduce confusion, and create a smoother healthcare experience for patients and families. It's both administrative and deeply supportive. 13. How do you handle communication between multiple healthcare providers? Highlight organization, clarity, and professionalism. Example: I maintain clear and timely communication with all providers involved in a patient's care. I ensure that each team member receives accurate updates, test results, and care plans. I use EHR systems, email, or phone calls depending on urgency. When relaying messages, I summarize key details to prevent miscommunication. I also follow up to confirm that tasks are completed. My goal is to create a seamless flow of information so that everyone is aligned and the patient receives coordinated, high-quality care. 14. What would you do if you noticed a mistake in a patient's chart? Show honesty, responsibility, and urgency. Example: if I noticed a mistake, I would correct it immediately or notify the appropriate clinician if it involved medical data. Accuracy is critical, so I would document the correction properly according to policy. If the error could affect patient care, I would escalate it right away to prevent risks. My priority is maintaining reliable records and ensuring patient safety. I believe in accountability and taking quick action when errors occur to maintain trust and care quality. 15. How do you educate patients about their care plans? Show communication and empathy. Example: I start by explaining the care plan in simple, clear language without medical jargon. I ask the patient what they already understand and fill in any gaps. I use written instructions or visuals if it helps and encourage them to ask questions. I also check for understanding using the teach back method. My goal is to make sure they feel confident, comfortable, and supported. I also provide resources, follow-up reminders, and contact information so they know I'm available to help. 16. How do you stay organized with patient caseloads? Show structure and reliability. Example: I rely on digital tools, calendars, and checklists to manage my caseload effectively. I track appointments, follow-ups, and documentation deadlines. I also organize my day by reviewing priorities each morning and adjusting as new needs arise. Keeping communication structured helps me avoid missing tasks. I maintain detailed notes so that I can quickly pick up where I left off with any patient. My focus is always on staying consistent, efficient, and thorough to deliver quality care. 17. Describe a time you improved a process at work. Highlight initiative and problem solving. Example. In my previous role, our follow-up system lacked consistency, causing delays in patient updates. I suggested creating a standardized follow-up checklist and timeline that tracked patient communication more clearly. After implementing it, our team saw fewer missed calls and smoother coordination. The system made workload easier to manage and improved patient satisfaction. This experience taught me the value of small improvements that create long-term impact. I enjoy identifying ways to streamline tasks and enhance efficiency. 18. How do you build trust with patients? Focus on empathy, reliability, and respect. Example. I build trust by actively listening, showing empathy, and treating every patient with respect. I take time to understand their concerns and explain information clearly. I follow through on what I promise, such as calling them back or checking on a referral. I maintain confidentiality and create a comfortable, judgment-free atmosphere. Patients need to know they can rely on me, so I'm consistent, patient, and supportive in every interaction. Trust builds over time through genuine care and professionalism. 19. How do you handle patients with different cultural backgrounds? Show sensitivity and openness. Example. I approach cultural diversity with respect, curiosity, and non-judgment. I listen carefully to their preferences and acknowledge cultural or religious practices that may influence care. If I'm unsure about something, I ask respectfully rather than assume. I also use interpreter services when needed to avoid communication barriers. My goal is to create a comfortable environment where every patient feels understood and respected. Cultural competence plays a crucial role in providing personalized, effective care. 20. What's your experience with insurance and medical authorizations? Highlight administrative experience. Example. I have experience handling insurance verifications, referrals, and prior authorizations. I understand how to communicate with insurance providers to clarify coverage and resolve issues. I help patients understand their financial responsibilities and guide them through available resources or assistance programs. I'm detail-oriented when collecting required documentation and ensure everything is submitted correctly. My goal is to reduce delays and prevent confusion for both patients and providers by managing the process efficiently. 21. How do you communicate bad news or sensitive information? Show empathy and professionalism. Example. I share sensitive information with compassion, clarity, and calmness. I choose a private setting, speak gently, and avoid overwhelming the patient with medical terms. I pause frequently to allow questions and check their emotional response. I provide reassurance and let them know I'm there to support them. If needed, I involve a clinician for further explanation. My goal is to ensure the patient feels supported, respected, and informed during difficult moments. 22. What motivates you in this role? Focus on purpose and compassion. Example. I'm motivated by helping people navigate complex healthcare situations and seeing the positive difference it makes in their lives. Knowing that I can reduce a patient's stress, improve their understanding, or help them access care is incredibly rewarding. I enjoy collaborating with healthcare teams and being part of improving patient outcomes. This role allows me to use my communication, organization, and empathy to create meaningful impact every day. 23. How do you respond when a coworker needs help? Show teamwork and dependability. Example. I believe strong teamwork improves patient care, so I'm always willing to help when a coworker needs support. If I have the capacity, I step in immediately. If I'm managing urgent tasks, I communicate clearly about when I can assist. I offer guidance, share resources, or help coordinate tasks to lighten their workload. A supportive team creates a healthier work environment, improves efficiency, and ensures patients receive high-quality, consistent care. 24. How would your previous coworkers describe you? Highlight positive traits aligned with the job. Example. My coworkers would describe me as reliable, compassionate, and highly organized. They know I'm someone who stays calm under pressure and communicates clearly with both patients and staff. They trust me to follow through on tasks, maintain accurate records, and treat everyone respectfully. I'm also known for being a team player who's always willing to help. I value strong working relationships and contribute to a positive environment. 25. Why should we hire you? Summarize your strengths and match them with the job. Example. You should hire me because I bring a strong blend of experience, communication skills, and genuine dedication to patient care. I'm highly organized, detail-oriented, and committed to creating a positive patient experience. I work well with healthcare teams, handle challenges calmly, and maintain accurate documentation. I'm passionate about supporting patients and ensuring they receive coordinated, efficient care. I'm confident that my skills, reliability, and enthusiasm make me a valuable addition to your team. Thanks for watching. I hope these top 25 Care Coordinator interview questions and answers help you feel confident and fully prepared for your interview. Remember, practice makes perfect, so review these answers, personalize them to your experience, and speak with clarity and confidence. If you want scripts for other job roles, comment below and I'll make them for you. Don't forget to like, subscribe, and hit the bell icon for more career boosting videos. Good luck, you've got this.